Good evening, everybody, and welcome to this meeting of the Employment Committee. I'm Councillor Stuart Brown, Chair of the committee. Before we start, just a little housekeeping and safety information. If the continuous fire alarm sounds, evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust's fire marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. So let's go around and do introductions, starting on my right.
Councillor Simon Bowshire, Drayton and Farlington Councillor.
Dave Ashmore, one of the Fratton councillors.
Darren Sanders, Baffins, Ward Councillor.
Councillor Charlotte Gerardo, Central Southsea.
Rochelle Williams, Human Resources.
Jane Didino, Local Democracy Officer.
Lovely, thank you very much. I've not been notified of any apologies. We haven't got Councillor Corkery in the room as of yet. He may be on his way, but we're going to crack on regardless. So, the first item on... there we go. Councillor Corkery, thank you for joining. Welcome, welcome. Members, are there any declarations of interest anyone has to declare? Councillor Gerardo.
I am a member of GMB and Unite the Unions.
Thank you. Councillor Corkery.
No, apologies, been slightly late. Also a member of Unite.
Thanks. Any other members with interest to declare? If not, we shall move on to the minutes of the meetings held on both the 1st and 17th of July 2025. Members, are there any issues to raise with either of those sets of minutes? Agreed that they are a correct record? I see no dissent. Lovely. Those are agreed. Next item on the agenda is the overview of upcoming employment legislation, and I'd like to invite Rochelle to introduce the report, please.
Thank you. So this report has been brought back. We brought this originally in November of last year, so it's just an update. I do have an update on the update because since writing the report, there's been a few updates, so I'll probably start there just so we're all on the same page. So since the paper was written, we're still anticipating that the changes will become an act, and we're still anticipating that will be this month. But as we're over halfway through the month, that is looking slightly less likely than we anticipated at the time of writing the report. The reason for that is that the House, they're in a ping-pong period, essentially. Not everything that was put forward has been accepted, so some of the amendments are still being considered. So we're now waiting for this to be approved and so that we can move forward, but we're not given a specific timescale on that at this moment in time. But we're optimistic that none of the proposed timeline for 2026 and 2027 will change. It's just the approval process, and then when we will receive royal assent, because there will be the Christmas closure commencing on the 18th of December. So if we don't get an answer quite quickly, we may have to wait until the new year. So that's the updated position, where the report says we're expecting this to be in November, but I appreciate we are on the 20th and we're not in that position yet. My one, okay, yep, no problem. In terms of the themes are still the same as they were before. So we're looking at family-friendly rights, so changes in relation to bereavement leave, post-maternity dismissal protections and flexible working, fair pay, which is looking at reforms in relation to sick pay, the fair pay agreement for adult social care and the entire sector. We've actually got a live consultation open at the moment for that, which we're supporting adult social care to respond to. Minimum wage, proposed changes. And then we move on to flexibility. So we have changes in relation to 0 hours contracts and the right to guaranteed hours based over a 12-week average period. The removal of the fire and rehire, so new protection on automatic unfair dismissal for certain contractual changes. And then we have equality at work, so equal pay, extending this to ethnic minorities and disabled workers, and mandatory pay gap reporting and action plans associated with those. Stronger harassment protections and potentially including third-party harassment. And then last but not least, enforcing rights, so creation of a fair worker agency to consolidate enforcement, review of health and safety guidance, so we'll be looking at things like long COVID and more around neurodiversity. And then we have VOICE, which is the trade union reform, which is essentially looking at the modernisation of the trade union laws and reinstatement of some of the things that were originally removed, which we briefed you about in November. So no fundamental changes since the last time we met you. We've included the same table and we've updated that. Some of the things already included are on PCC's radar, so things in the equality area, those were already in our action plans, regardless of whether the law was changing in that space or not. So it's just if there's any questions.
Thank you, Rochelle. Members, any questions? Councillor Sanders.
Thanks, Chair. Just a couple, Rochelle. The first one is and they're both linked. The first one is regards to the social care sector fair pay agreement. You say that the proposed due date is October 2026. I thought that the new package was not meant to come until 2028. Am I right on that one?
I would have to check. We've been told 2026, but there might be a roll-in period, so I can
Yeah.
check that and come back to you offline.
The two things are linked because if it comes in for 2027, then if we're, for instance, forced into merging with other councils, then that has a potential issue with regards to differential rates between Hampshire and Portsmouth, for instance, and also issues around whether any increase would require the permission of the new authority, even though it's implemented by the legacy authorities. Because we've been told anything over £100,000 that's spent by the legacy councils, which in this case would be Portsmouth and Hampshire, in 2027 will have to be agreed by the new council, which all sounds a bit mad. But what I don't want is us to get caught up in that sort of treacle and
Yeah, and I think we will get caught up to some extent because lots of the proposals in here overlap with any potential LGR,
Yes.
which makes ours more complex
Yes.
than any other
That's what I was saying. If it comes on
arrangement
the 1st of April 2028, that is not our problem.
in terms of practicalities, any likely changes under LGR will be covered from an employment perspective by TUPE. So there will be a degree of protection for staff. Whatever the existing authorities agree, the staff will be protected on those terms and conditions moving into the new authority until such a time that those can be harmonised in a legally compliant way, which will be a long drawn-out process in any case.
I understand that's more the financial impact.
Yeah, the financial impact. I
new
can have
authority,
someone
which
from
is already
finance have a
stretched.
look at that. I wasn't aware of the 100k rule, but we can
Yeah,
certainly have a look at the
it's
timelines.
really, what we've been told is really mad. But yeah, and also I'm understanding that there is no extra cash available from government for this new burden.
No money, no.
Okay. And then my second point is a related one because it relates to the reintroduction of the teaching support staff pay body, which I'm assuming also has no money available by government. Do we have any ideas as to realistically when that might be coming in? Because I think it was one of those that had nothing in
We
terms of
haven't got
dates.
a timeline for that yet or been able to
Okay.
do any costings at this point.
Okay.
no.
Now I understand that. It's just that's potentially long-term problems for whichever people have to deal with it.
Thank you. Members, any further questions on the report? I think, Rochelle, it might be useful just to give us a sort of a brief summary of like the changes that are already parts of PCC policy, if there are any, and also the preparation for working with other officers from other authorities as and when LGR does or doesn't happen. Because I think there's been some work done preparing us for the changes, hasn't there?
Yeah, absolutely. So there's already HR and OD working groups in place. So at the last meeting last week, we're at the point of just capturing all of our existing terms and conditions. We're also participating in all of the consultations that are live as part of the Employment Rights Bill as well, so feeding in our concerns, because the adult social care, it's across the sector, so we don't know how much it will impact our staff directly as such. It may be the wage bill as opposed to our direct staff, depending on the outcomes. But we're working with all of our neighbouring authorities, and we're also looking at wherever possible and wherever practical for each authority to try and make decisions that are the same. So where we're giving some flexibility, that reduces the differentials across the piece. But obviously it needs to work for all of the existing authorities. But those things are being discussed in that group to say this is coming in, this is how we're approaching it. These are the questions we're asking. Where we can get that agreement across all of the authorities, we will do the same, so then there's less impact on staff moving forward. And some of the proposals, the authorities already have better terms in place in terms of special leave and things like that. So we just need to have a look and work our way through all of those things, but capturing it all now so we can see what the impact is, not just for ourselves, but anyone else that we may be working with in the future.
Yeah, and personally, I can't speak for the rest of the committee, but I'm certainly very reassured that that work's all going on in advance rather than playing catch-up later down the line, so thank you. Members, any other questions or comments on this report? Councillor Corkery.
Thank you, Chair, and thank you, Michelle, for the report. In terms of, there's quite a specific question, so you might not have a view on it, but I'll ask anyway because I'm curious. The outsourcing and equal pay provisions of the legislation talks about provisions that services can no longer be outsourced to avoid paying people equally. And we've talked in here about well, presumably that won't apply retrospectively to existing contracts because legislation usually doesn't. But I guess I'm curious about the point at which contracts then come up for retender. Will that be deemed to then apply at that point, or will that be a continuation of that? Because I guess if it is then going to deem to apply to the new contract moving forward, that's potentially going to have a big impact on where services are contracted out and outsourced.
And the reality is we just don't know yet, so we're preparing for all eventualities. These are the details that will be in the codes that which will come alongside the bill, and because we haven't gone through the approval process, we just haven't been given any of the codes of practice or even insight in terms of what they may include at the moment, so we simply don't have any insight. We can certainly ask the lawyers again, but so far nobody's really wanted to kind of give a summary of what they think may happen. So we don't know, but it certainly would be very unusual to apply anything retrospectively. It will all be moving forward. It's just if you've already got a contract in place, at what time does that come in scope and what's the lead-in time for it, which we haven't been given the details on yet.
Thank you very much. Members, if there's no further questions, the recommendation is that we note the report. Is the report so noted? Lovely, thank you very much. Moving on to the sickness absence biannual report, and back to Rochelle.
Okay, thank you. So the purpose of this report is to update the committee on the sickness absence levels and causes across the council. This report, you may have recalled in the other meetings, we were in the middle of an upgrade into our system, so getting hold of the data was a little bit trickier. This is the first time we've had a full 12-month period of worth of reporting, so can compare it to the last 12 months. In the report, we've given you an overview. It's not great news in terms of absence levels. So overall sickness absence has increased from an average of 9.6 days to 10.37 average days. The greatest impact we've seen there is in long-term absence, which rose from 4.93 to 6.26. So we are seeing an increase in our long-term absence. Those directorates with the highest increases have been noted in the report, which are the Port, Finance and Resources and Corporate Services. We have had some good news. A few services did have some decreases, which were Adult Services, HMBS and Education. The top reasons for absences remain static, as they have done for some time now, which is psychological stress, anxiety and depression. And in Appendix 2, the way that the table's been printed, you can't see, but I can see on my screen. Psychological stress, anxiety and depression, there's two in the box. The second one is work-related, because members asked us some time ago to differentiate between work-related. That's why there's two in there, but you can't see that as well as I can. Then we've got viruses, cough, cold and flu, and musculoskeletal lower limb. We've given you some analysis around the role-specific insights, and we've given you an overview of the interventions that we're working on. Since producing this report, because we had this report at the end of September, we've seen that increase and we've now got data, so we do have a bit of an action plan in place that we're working on. So I'm happy to talk you through that, because it may answer some of your questions, and then we can come back to any other questions that you might have. So we recently ran Wellbeing Roadshow over in the civic offices, as well as going out to some of our services. So we're just using that data and insight to understand what staff are feeling and how they're responding. And the overwhelming thing that we realised is anything that we put on where we provide services, we are inundated with people wanting to access them. So in 3 hours, we had 98 people take up flu vaccinations and people coming to ask us for more. Where before, when we've given out vouchers for people to be able to access them, we just simply haven't had the demand. Where we had health checks, they were booked up instantly, again, with a waiting list of people wanting to undertake them. So we've got some real insight into what people want, and more importantly, where they want it, where it's convenient for those to access those resources. Our current challenges, which is not surprising from the data, is including stress and psychological issues, and they're driving up our high absence rates. They're also putting quite a significant strain on our EAP contracts. So we've had an influx in people seeking support, which is also causing a delay in the availability of that support. So we're working really hard with the provider to try and improve that offering. And we've also got really, really long waiting times with the NHS. So what we're now doing is a real deep dive into the roles specific and the reasons for absence, and seeing what else we can do. So for example, Moving forward, we've got one-to-one training for managers around menopause. We've got a menopause working group, but we're also going to have access to, it will be a paid service in a similar way to occupational health, but a specialist menopause advisor. So instead of referring everyone simply to occupational health, kind of for more generic advice, we can make a choice as to whether we go to Oc Health or whether we use a service that's more specific. We're also looking into what the options may be around physiotherapy with our university colleagues to see how we can access that. We do have reductions for some of these costs if people are choosing to go to these privately, but it's not particularly well signposted. So again, we're going to bring some options together and see what we can provide to the organisation and what funds there are available. Our occupational health bill is higher than it's been for a long time. We're spending about 10k a month on Oc Health referrals because of our long-term sickness. So we're really going to do a deep dive to try and understand the specific reasons people are off and what further targeted support we can give in that area. But we do know that when we provide the interventions that are accessible, when we are in the workplace with staff, we are overwhelmed with demand. So those are the types of areas that we're looking at. Also looking to increase our female health work. I know we've spoken about that before. The menopause has been our primary one, but we are moving on to other areas because we've now made contacts with the right people to be able to do so. So looking at targeting where we are seeing high levels of absence. The other areas we've got are, we've got an ageing demographic of workforce, so we do have areas that are cancer related, and again looking at what we can do, because we do allow time off for cancer screening. We need to make sure that people are aware of that and also work with our more male-dominated workforce around their cancer screening and making sure people are taking those up and seeing if we can deliver that in a different way, seeing if we can get people to come to us instead of our staff having to go to them. So we're exploring lots of options. So hopefully in the next time we come back, we'll be able to give you a bit more detail on that. But we are aware of the issue and how we need to tackle it, but happy to take any questions.
Lovely, thank you very much, Rochelle. Members, Councillor Gerardo.
Thank you, Chair, and thank you, Rochelle. Oh, sorry, my phone's too close to the mic. Apologies. Thank you also for the sort of creative ways that you're trying to sort of deliver services that will tackle some of the sort of key issues that are coming up. It sounds like, you found like services and locations that are really effective and are encouraging take-up, so that's really positive. And it's really good to hear about other areas of women's health, because things like menstrual health, fertility issues, they are very common issues that affect a lot of women. There'll be a lot of women who'll be off every month because they're in excruciating pain because of their periods, and they might not know that they've, I don't know why this is still buzzing, sorry. My tech is well away, sorry. And they might not know that they've got things like endometriosis or polycystic ovaries, which is something that is often really poorly diagnosed and there's just a lack of awareness of. So, it would be great if we could move into other areas of women's health like you've recommended. Thank you.
Next two on the agenda are period health and gynecological care. We haven't launched that recently because it's Men's Mental Health and Men's Awareness Week this week, so we're focusing on that. We don't want to send out too many confusing communications, and so everything has been around men's mental health and suicide prevention and everything like that in that space over in the civic and wider the next week, but that's next on the horizon. But the menopause one is the one where we just had so much demand because of the demographic of our workforce. We really wanted to get that up and running and established, and also make sure that people were receiving the right type of support, because as you've just said, it's our GPs are under significant pressure and they're not always necessarily the right resource anyway. There are people out there who are specially trained in female health and men's health. So we've now got access to that. I'm hopeful that that will provide our workforce with better insights on how to manage their symptoms and what we can do as well.
Councillor Corkery.
Thank you, Rochelle. In terms of disability-related leave, would that be recorded under the sickness management policy and reflected in these statistics, or is there a separate policy for recording disability?
There's not a disability leave. You're either sick from work or you're not sick from work, but you would have, your record would have that you had a disability on there. So that's when, in terms of managing the absence, it would be expected to be managed slightly differently than you would if you didn't have an underlying medical condition or a disability, for example. But there's no other separate category. Absence is just absence.
And just following on from that, I'm not quite sure exactly what system we use in terms of triggering sickness reviews, or however they're called. For that purpose, is disability separated out, or would a period of absence of a sufficient amount trigger, no matter whether it's disability related or not?
We don't have triggers at the moment. We did many years ago, but we removed those because what we found at the time is that we were driving waste into the system, essentially, that we were saying, like, everybody that hits these days has a meeting, and actually it turned out, you know, someone had broken their leg, or someone was off for a bereavement, really understandable reasons as to why they would be there. And actually our involvement and our impact the impact we were having was very low. So now it's based on managers knowing their staff and having those conversations and having access to data. So there's no specific trigger. What we would tend to do if it was somebody with an underlying disability is look over a longer reference period, look at the adjustments, involve occupational health, and see what we can do to sustain that person in work. You would only really consider employment options if you had exhausted all of the reasonable adjustments and you still weren't having a positive impact on that person being able to attend work on a regular basis. You're also looking at the overall impact on the service, so what's the real impact of that person not being there. So we don't have huge amounts in that area, but that would be the general way that we would look at it, but there's no specific trigger. What we have done recently, because our services have been slightly disadvantaged because there's been the whole rebuild of the system. So whilst they've had access to absence data, they can physically view it. They haven't had any meaningful reports, so anything that summarised it in a way so they can see trends and have that analysis. Those reports are now developed, they've been tested and are ready to go live. So we're hopeful with all of the interventions we've got and with our management population having access to better data, you would hope to see that trend removed, but we certainly don't have triggers at the moment. Some services have it unofficial. They'll say, oh, we want, as a manager, I want to know anyone that's above a certain amount of days so that we just understand what's happening, but there's no corporate messaging.
And just another question about the statistics. In terms of work-related stress, or however it's termed on there, absence related to work-related psychological issues, is that recorded through self-identification by the person that's been absent, or is it the manager says that it's work-related?
It would be employee-led. So that's the reason that the employee is reporting their absence. And sometimes it changes, so partway through it might be work-related, it might turn into something else, but it would be employee-led.
The detail of that, is it a kind of box they tick, is it, to say, was this work-related, or do they have to kind of proactively say this was work-related?
So you have, when you're communicating that you're sick, you normally give a reason as to why you're unwell, and if that's the manager's interpretation, but the employee can see their own absence record as well, so if they disagree with the reason, but also on a return to work. So we might see a reason when the person first goes off, and it might change once you've had a better indication of what's happening, or you've been to occupational health and you've established in there that it's work-related factors that have caused the absence, but it would be agreed with the employee.
Thank you. Members, any other questions on the report, please? Rochelle, I just wanted to quickly just double check. I know in the briefing we found a slight numerical error. Did you find what happened with that?
We did, and it was corrected. I did send you an email after the committee to say thank you. We've updated it, and the correct version was published. So nobody, unfortunately, other than you, saw that version. But thank you for highlighting that.
No worries. Thanks for getting it sorted. Members, we have quite a few recommendations for this report. So we are recommended to note the increase in absence levels across the organisation, the levels and causes of sickness abscess across the council, the activities and interventions undertaken to support attendance and improve health and well-being, the information regarding VIVUP, and the directorates showing the highest increase in sickness absence are the smallest amongst in terms of headcount. Members, are those 5 issues all noted for this report? Lovely, thank you very much. And then for the third and final time tonight, back to Rochelle for the workforce profile.
Thank you. So this is normally Natasha's report, but she's not with us, so I'm picking this one up for her. So the purpose of the report is to provide an annual overview of the council's workforce. It supports the equality and diversity commitments and meets our statutory requirements under the Equality Act. In terms of the report, the only things that have changed from the last report in terms of contents, we've removed some statistics relating to gender pay gap reporting because it was a little bit confusing. Because we report on that on a statutory basis, the timeframes were slightly different, so we were just conscious we were bringing two different figures to members in a relatively short period of time that perhaps didn't give a very clear narrative. So we've removed that and we'll keep those in the statutory reporting, which is in March. So in terms of the summary of the report, the total employees, it's the highest it's been for a few years, and that's because we brought waste management into the organisation in this reporting period, which was quite a large working group. We have the majority of the positions are full-time and filled against the establishment, so the establishment versus people in roles. In terms of directorate distribution, the largest directorates are housing, neighbourhoods and building services, which make up about 27%, children, families and education around 18%, adult services 16%, and our smallest are port and public health, as we know. In terms of location, the vast majority of our staff, so 97% of staff still live in PO or SO postcodes, with very few living outside. That's included because during COVID, obviously we did see a shift in demographics and where people were working, but we've seen that slowly come back to PO, SO postcodes. In terms of gender, the split remains reasonably static, 64% female and 36% male. Our females dominate our part-time roles, and 94% in the part-time staff. The age profile, the largest age group we've got is the 50 to 59s. Again, this is reflected through to our absence in terms of the types of ailments you're likely to get with an ageing workforce as well. 20% of our staff are aged 60 plus, and this is up from 15% in 2019, which correlates with those people still being employed and ageing. The under 30s and the over 65 are the least represented in our workforce. In terms of ethnic origin, 8% of staff are from ethnic minority backgrounds, and this has increased from 6% in 2023. The most represented group are Black African with 2.2%. In terms of disability disclosure, and Cal, this is another one that links through to the absence. So if we're dealing with absence cases and it's identified by occupational health that somebody has a disability and it's not currently recorded on the system, we will also ask for permission to update their record, because the longevity, the length of time people are employed with us, they may not have had a disability when they joined the organisation, but later through. So we have 15% of staff who have disclosed a disability, and this is up from 11% in 2023. The data is self-reported via Fusion, so all staff have access to be able to update their own record at any time, and that's for them to own. Employment category, we've got 66% full-time and 34% part-time, and adult services have the highest proportion of part-time, which we would expect due to the nature of the work. In terms of pay bands, we have over 2/3 of staff are in bands 3 to 8, and just to provide you with a little bit more context, band 3, the bottom of band 3 starts at 24,697 in terms of salary, and the top of band 8 is just over 39,000. So just to give you an indicator of what that actually means. We've seen an increase in bands 5 to 6, and this is due to bringing in waste management. And again, the salaries for those roles start at 26,473 and go up to just over 32,000. To give you an indication of that. So unless there are any questions, that's the overall summary. There are no significant changes that we need to be alert to, other than the bringing in of quite a large service, which has had an impact on staffing numbers.
Thank you, Rochelle. Members, any questions? Councillor Drada.
Thanks, Chair. Thank you, Rochelle, again for another good report. I just wondered on point 6 about women obviously being more likely to work part-time. Also, granted, we do have more women in our workforce. I just wondered if there had been any sort of internal communications and promotions of the doubling of nursery hours, just because someone who is recently benefited from this, which is making a huge difference to monthly expenditure, that would definitely, well, it could encourage more people to work full-time or increase their hours because nursery is more affordable.
No, that's a really, as a mother that just missed out on that, I'm heartbroken. Mine just started school. There hasn't actually, and it's a really interesting point, not to my knowledge, but I will link in with education colleagues and just see if anything's gone out via that. part. But what we could do is when we're looking at the more the female work-related groups, staff groups and female health, it might be something we pick up as part of that as well. Or we could potentially signpost in some of our flexible working policy. You know, when you're looking at flexible working, what you're doing, it's potentially could have some links there. So I'll certainly pick that up.
That sounds really good. Thank you, Rochelle. And obviously not to assume that women who work part-time just do it because of money, but definitely that enters into the thinking because it's just so expensive. So, yeah, that sounds great. Thank you.
Members, any other questions on the report? Councillor Ashmore.
Just one really. I'm noticing that we're underrepresented with those in the youngest age group there, which is obviously 16 to 24. I'm sure we do have something, and I appreciate it's not your report on it, so you might not know the exact details. But do we have something where we're working, you know, proactively with the colleges, universities, and that sector, so they know what we're about, and we've already got those established relationships that might help, you know, graduates apply for jobs here and set up?
Yeah, we do. We have some really successful schemes, HMBS being one of them in terms of their graduate scheme. You'll see that if anyone that comes to the apprenticeship awards, they come in vast amounts in HMBS and surveyors. We are most likely, and it's having entry-level roles, essentially. We don't have a huge amount of recruitment. Budgets are restricted, so services are tending to look for people kind of who can hit the ground running. But our avenues in are the apprenticeship route. Obviously, not that that is specifically targeted at any particular age group, but they tend to be more entry-level roles or roles that come with qualifications. So there's that incentive there. We're also working with education at the moment who are looking at supported internships. So they deal with that anyway, but then looking at potential work trials within the workplace. So our social value partners are already doing that. So looking to see if that's something we can bring in here. So there's engagement with directors at the moment around that. We also have really strong links with our local universities. So if we have recruitment fairs or job fairs, or they do, we'll interlink with those. But people are tending to go to college at the moment rather than entering the workplace at a young age. That's kind of a national trend. But we are working with the colleges where the opportunities allow. If there was more resource, more capacity, there is a lot more that we could do. But with one FTE, and we also got our care experienced individuals as well, so we work with those. So in terms of the corporate commitments, we've already got a few disability, armed forces, care experience, then we're looking at interns and apprenticeships. So with limited recruitment and quite a few corporate commitments, there's a balance as to how many opportunities realistically we will have. So we are pulling on our social partners, and the response rate's been really, really positive with those. So not just ourselves, but using the wider Portsmouth network.
And that's really brilliant to hear. So even with limited scope, we're doing loads.
Thank you, Rochelle. And I think slightly related to that, obviously you mentioned that we have an ageing demographic in the workforce, but there is some work being done around succession planning and future-proofing.
Yeah, absolutely. So again, LGR is kind of in the horizon as well. It's thrown a bit of a spanner in the works because where we were engaging with staff about what their future plans may be and who we need to bring through, people are less certain about what they want to do now because they're not sure what will happen there. So it's making things slightly challenging in that department in terms of any certainty. But we do have career pathways, so we've worked with services where there are recruitment and retention issues. Our pay team work with services to develop a graduate routine, essentially. So we have roles at every single level. So when we're going to market, we can offer the experience at a very wide range, depending on what skills you've got. So we're doing that in legal, for example. So we may need a Band 12 solicitor, but we may accept we'll bring in someone at Band 6. We'll work with them through the bands and grow our own, essentially. We've done that very successfully across HMBS. We've done it very successfully in planning, where we had the Trailblazer apprenticeship route as well. So really utilising the levy to upskill either our existing workforce or those who we're bringing in to bring them through the organisation.
Thank you. Members, any further questions on this report? Councillor Corkery?
Just picking up on that point about utilising the levy for apprenticeship funding, understand there's proposed or maybe even implemented changes to level 7 apprenticeship funding training. I just wondered if we were previously accessing that for certain roles and if that's going to have an impact.
We were, and it will, yeah. So level 7 is our, your most senior leadership roles, essentially. So in terms of upskilling our workforce, yes, it will have an impact. It's not come into play just yet, and we do have people on existing level 7 apprenticeships, so our apprenticeship lead is just working through the impact of that. And from our perspective, we had a career pathway of like a leadership and management that went from level 3 all the way through to level 7. So we had the internal PCC offer for all new managers, and then depending on where you were, you could go to level 3, level 4, level 5, all the way up to level 7, when level 7's being removed. I think that's because the government are perceiving that it's being used to upskill existing workforce as opposed to bringing in new people. So there's a balance to be had there. We have responded to the consultation, but it's looking likely that, yes, that will be removed and it will have an impact, but more likely for our existing workforce than those we're bringing into entry-level roles.
Members, if there's nothing further on this report, the recommendation is for the committee to note the contents of the report and the attached workforce profile. Is that so noted? Lovely, thank you very much. That was the final item on the agenda, so I shall close the meeting and wish you all a very good evening. Thank you.